Bob Barkley was a legend in dentistry back in the 60s and particularly in the 1970s. And he ended up writing a book called Successful Preventive Dental Practices that he published in 1972 that was wildly popular. And he toured the country and he spoke oftentimes 8 to 9 times a month. And he did that year after year after year, all the way up until his untimely death in 1977 in a plane crash. Bob would speak to convention audiences sometimes as large as 3,000 people. He's a very dynamic speaker, and he focused really on two things: prevention, as well as communication and learning, or learning how other people learn, I guess you could say. And he connected the two things together because, as we've all experienced in dentistry, not that many, we show people what they need to do to take care of themselves better, but it's only a small percentage of those people that actually do it. And this was a riddle that Bob really worked on. And he figured out a way to connect with people to get his success rate up with people higher and higher. And what he realized was, once people became more healthy and they realized that actually they were in control of their health more, then the outcome of that was the people started choosing more and more fine dentistry. So it was a win-win situation, but it required him to invest on the front end and into essentially developing the person, developing the patient, deepening their understanding, clarifying their values and priorities, and then getting them to commit to certain concepts or ideas. And eventually they would sit down and develop a comprehensive treatment plan that might take a couple of years to execute, but they were always working together in a goal-oriented way. So Bob really was one of the first people that kind of created this goal-oriented relationship. And when I say that, I don't mean, me as a dentist imposing my views on you, Gary, the patient. I mean, you and Gary and I together sit down and decide what Gary wants long-term. How can we achieve that? How can we fit that into Gary's life? How can we make that work with Gary's budget and all these, realistic, real world issues? Bob pioneered all that stuff and traveled around the country and taught it. And he was an absolute phenomenon.
Now, he was doing this in his own practice, which, again, I want everyone to know was a small town in downstate Illinois that I think we could generously call it a one stoplight town. Would that be a good definition?
Yeah. And
where he practiced?
That brings up another relevant point, which is Bob Barkley was a student of Dr. Pankey, LD Pankey. And he trained under Dr. Pankey probably in the early 1960s. He started taking courses down directly from Dr. Pankey. This is before the Pankey Institute even existed. And he started taking courses down there, and he was absolutely convinced that this was the best way to practice. So he brought all these ideas back to Macomb, and Macomb was a town of about a city or a town of about 10,000 people, small university there, mostly a farming community. You could drive 100 miles in either direction. It's flat as can be, nothing but cornfields. And so they were businesses and industries that basically were related to the farming industry at that time, and small farms. These are not corporate farms. So these were not wealthy people. These were middle class or lower people on average. And so Bob tried to bring Dr. Pankey's concepts into Macomb, and people financially, it wasn't within their paradigm, and it wasn't really within their culture either. The average person in Macomb by the time they reached the age of 60 had 6 remaining teeth in their mouth. So imagine the challenge of trying to convince somebody that's, let's say, 30 to change their mindset about their destiny in dentistry when everybody they know, everybody in their family is either fully edentulous or well on their way. And their mindset is, my family has bad teeth. Why should I spend a lot of money on myself? That's my destiny too. So for Bob to overcome all of that mindset, that this thought in the majority of people's head that their destiny was to lose all their teeth anyways. Why should I spend all this money with Bob Barkley or whoever office they wandered into? Why should I do that? Why is that relevant to me? So, Bob, to get around that hurdle, Bob did a tremendous amount of work in the area of psychology and learning and all kinds of things to help people reframe their perspective of dentistry and to see it in a more whole health perspective. So Bob was one of the pioneers, because of Dr. Pankey, in bringing a holistic perspective of dentistry relative to whole health into the profession. This is very, very new.